So the fallopian tube is mainly divided into like 3 parts: interstitial part, then isthmus part, then ambula. In the ambula, the fertilization occurs, and this is the infundibular part. In this part, it has fimbriated end, and the follicle is usually picked up from this area. So the main function of the tube is like ovum pickup and a transport of the fertilized ovum to the uterus. And it's also having some secretions, and also cilia are there, which supports the flow. And moving to the histology, it contains the mucosal layer, the muscular layer, and the serous layer also. And the clinical aspect is of that ectopic pregnancy. There is ectopic pregnancy, means pregnancy outside the uterine cavity. Okay, it can be either in the interstitial portion or in the isthmus portion or near to the infundibular portion. So unlike the uterus, the fallopian tube will not stretch that much. So there may be a chance of rupture if the diagnosis is missed. Next is hydrosalpinx. Hydrosalpinx means hydro means water. Water which get filled in the fallopian tube. That is known as hydrosalpinx. If there is some occlusion, if there is some obstruction or occlusion in the fimbriated end, it can be due to infection or it can be due to endometriosis. If there is an inflammation and occlusion here, then what happens? This inflammation mediated cell response, there will be more secretion of the fluid from this epithelium, and there will be less reabsorption. So more fluid is secreted and less reabsorbed. So the fallopian tube become more tortuous and like engorged. So the main function, like the pickup of the follicle, the fertilization, it all gets blocked. It may be a reason for infertility also. So even after the treatment of this hydrosalpinx also, the normal function of the tube is regained is little bit less, and there is more chance of ectopic pregnancy also because of it lost its normal like movement. The blood supply is contributed by the uterine artery and as well as ovarian artery. It drains into the right and left ovarian vein. Now we will see the ovary. Ovary are the female gonads which lie in the ovarian fossa. The measurement of ovary should be known, 3 into 2 into 1 centimeter. And also volume is usually mentioned. In like PCOS patient, we can see the ovarian volume increases like 10 cc, 15 cc, like that is mentioned. And it is like placed in the ovarian fossa. The main function of ovary is steroidogenesis, that is production of hormone, ovarian hormone, and also the production of follicles also. So ovary is attached to the uterus, the corona of uterus by the ovarian ligament, which is a part of the round ligament also, round ligament. This like a laparoscopic view. This is a laparoscopic view of the uterus. You can see this uterus. This is the round ligament. This is the ovarian ligament, ovary, fallopian tube. This is a uterosacral ligament. You can see it clearly. Intestine coils you can see. So ovary is on the laterally, it gets related to the ovarian fossa, and the structures which like fallopian tube, which almost cover the upper portions of the ovary. And hilum is the area where the ovarian vessels and nerves enter to the surface. Histology is mainly the ovary consists of ovarian cortex as well as medulla. The cortex is an important one because the cortex contains so many tiny primordial follicles. That is, so many seedling follicles are seen in the cortex. And also you can see the developing follicles also in the cortex. And another thing, medulla. Medulla is the innermost area. It contains so many loose connective tissue, blood vessel, nerves are also seen in the. And one more thing is it contains hilum cells. That is the cells which are similar to the interstitial cells of testis. It is seen in the medulla as hilum cells. So ovary with follicle is this developing follicle, like developing like primary, secondary, tertiary, graphene follicle. Then ovulation occurs, then the remnant becomes corpus luteum form. So in certain patients that there will be developing of follicular cyst. Follicular cyst means this graphene follicle form but it failed to ovulate and it remains like a cystic structure. And the follicle cysts usually disappear even without treatment. After 3 months, it usually disappear. And luteal cyst also commonly seen in patients. So how the ovary reserve are formed? I had already mentioned that ovary contains so many primordial follicles. So during the embryonic development itself, the primordial follicles which are migrated to the developing gonads undergo rapid mitotic division. Mitotic division means multiplication. It gets multiplied into so many number. Like around 20 weeks, it reaches up to a 7 million in number. So after that, when it reaches after almost 22 weeks, it goes into meiotic division. So meiotic division, under meiotic division, and it reaches up to a particular phase, and it is covered by the flattened epithelial cells known as the prime, and then it is known as the primordial follicle. So these flattened epithelial cells are the future granulosa cells. So this protect the cell as well as its DNA also, because by a baby, a girl baby at her birth contains the enough follicles for the up to her menopause. So these follicles are usually developed after puberty only. So up that time it had to be preserved. The DNA and everything had to be preserved. So it is like a cryopreservation, like that. In the sleeping phase, it undergoes and preserved. So by birth, it reaches about 1 to 2 million primordial follicles will be present in the ovary of the baby or girl child. And when the girl reaches the around puberty, almost 4 lakhs is seen. So when there is a possibility of 400 follicles like to ovulate in the entire life of a female, only of this 1 to 2 million, only 400 is ovulated. The other become atresia. Atresia means or programmed cell death. This is an image like this embryonic development, primordial follicle and development. So the blood supply to the ovary is mainly by the ovarian artery, and the uterine artery also contribute to the uterine artery also contribute to the blood supply of the this ovarian function, and it's drained to the ovarian vein and the lymphatics like the lymphatic para ovarian lymphatics. Then in like anatomically there is some difference between right and left ovary, and even the right ovary responds more to the gonadotrophic hormone, as the gonadotrophic hormone, like from the hypothalamus, the gonadotrophic releasing hormone secreted, it stimulates the pituitary gland to secrete FSH. This FSH stimulates the ovary to produce the ovarian hormones like estrogen and progesterone, like in the menstrual cycle, like the follicular phase, ovulation, luteal phase, like that. In the first phase, estrogen is the primary hormone, and the second phase, the progesterone is the main hormone. So even it is both ovary respond equally, but clinical studies says that there is a 60% more chance of developing or like a successful pregnancy that the ovum or the follicle develop from the right ovary. So, and there are so many conditions related to ovary, like PCOS. We all know there are multiple developing follicles in the ovary. It is arranged in necklace pattern like that. PCOS is commonly seen. Another common condition is ovarian endometrium. Ovarian endometrium means there are chocolate cysts, there are cystic-like structure in the ovary. So these type of whether PCOS or ovarian endometrium all interferes the normal ovarian function, or all interferes the normal ovulation. Thereby, the normal ovarian function or ovulation or pregnancy is impaired. Okay, we had completed most of our topic.